Thank you.
Right, so as you can see, we have some
Okay.
slides
Oh, you know what?
prepared
I
on
bet you,
depression.
did you share?
But I know there was a
Matt?
mention of anxiety,
Okay.
there was mention of
Yeah.
other mental illness earlier when folks were coming into the
weird.
room. And we would be
let me
happy to
just
talk about
try
that.
to
We have
stop
time reserved
share.
for questions at the end of this
Where is-
presentation. So we'll give an overview of depression, which we think affects so many people, it's worth talking about.
Where's the?
But we'll have
Are you
plenty
in
of
Zoom?
time to talk about other
Where-
things that might be on your minds.
No,
related to
you're not
mental
in
illness.
Zoom right now,
Okay.
that's why. Oh, that's weird.
Let me go back there.
Yeah. It's our technical difficulties. It always, I apologize for everybody who now has to see my back.
Okay, now you can be, now at least I can see your back now.
But it's a nice shirt, and I just nodded and I'm just trying to show it off.
It's lovely. And now I see it, it's like a split screen. Is that right?
Yes, we're
Yeah.
all on here,
It'll
but-
keep moving around, but once they start talking only and I stop moving, you will see them only. Okay?
Oh, that's okay.
All right, thank you.
And can everybody hear us as we're talking up here?
Not too well.
Well, okay, we'll speak up.
That's great.
That's better. I'm gonna direct myself towards you.
I can see you, Barbara. Now,
Okay.
we're gonna share screen.
Share screen.
Oh, great.
Yeah.
We don't bite.
Front row.
That's it. Okay, there you go. All right, so now just go to presentation. So maybe, yeah, I'm not touching. Oh, it's a screen.
We have it over here.
You got it. Okay, perfect. We're good. All right, now we're ready to roll and
Okay.
I'll stop talking.
So, like Dr. Vin was saying earlier, we will be talking a little bit about depression, but we're happy to field any questions about all other mental illnesses at the end. So what is depression? Depressive disorder, which is often referred to simply as depression. It's a mood disorder and it's often caused by changes in your brain's chemistry. And certain people may be more predisposed to depression. But overall, it's a disorder that makes you feel sad, but it's more different than just sadness.
And so causes of depression. I don't know if any of you have had experiences with depression, either yourselves or family or friends, but there are a lot of things that can result in depressed mood. So some things like life events. Some people have to move from their house that they love, or they lose their favorite dog, or they have losses of family members or friends. Those events which cause sadness can also cause a depressive episode. If you yourself are dealing with pain, right? Chronic pain can be really, really difficult for people to manage. That can trigger depression as well. And then some people also have things that have affected them many, many years ago. So trauma in early childhood, sometimes that comes up in different ways. As we age, we can still experience depression related to that trauma. And if our family members have had depression, that means we're a little bit more genetically likely to have depression. Same goes for many other mental illnesses. If you have a parent who's had depression, you may be more at risk for depression yourselves. And then the last point here is also using certain drugs or alcohol. Those are things that can contribute to depression, because alcohol, maybe it feels good when you first have it, but it will bring your mood down overall. So if you're using a lot of alcohol or drugs that kind of change your brain chemistry, that can trigger depression.
You don't need this time.
Where you?
Like that.
Okay.
I don't know if this is working. Yeah.
I believe it follows the sound of your voice.
Yeah,
Oh,
right, but
That tower is called an owl, that it follows.
you can just click the next one, yeah.
Then we'll see. No,
I can do it on this computer, maybe.
nobody likes to know it more.
Oh.
But it's good to know it.
No, I don't think so, because it's, the share is on his laptop.
Okay.
It's
done.
I'll just,
That's the first one.
there we go. Nope, no, that's not what we meant to do. All right, there we go. And go ahead, there you go. Did you share it?
Suppose.
That's so weird. What happened? Oh, my goodness. All right, so.
I'm just talking. Yeah, and you said that you finished it, right?
Yes.
You had them all before, Barbara. You had them
Yeah.
all
Well,
before.
I know, this is a, it's a glitch. So we had it and something got hit somewhere along the way.
Yeah, but it's also.
Let me start again, that's it.
That's
Quiet.
not too much.
There we go. Okay, now we're back.
Oh, yeah, there we go. So depression can look like a lot of different things, and also the course of it can vary from person to person. So some people can be depressed for a period of 2 weeks. Other people, it might last a little bit longer. It could be a month, it could be years, and it might come and go. For most people, depression will change how they function from day to day. And like we said earlier, it's more than just sadness. It can affect a lot of different aspects of your life. It can change the way that you sleep. You might sleep a lot more than usual or a lot less than usual, or have trouble sleeping in ways that you didn't used to have. It can also change your appetite. So it can sometimes cause people to eat more or eat less, which leads to weight gain or weight loss. It can also change the amount of energy that you have during the day. So things that you might have wanted to do earlier might not appeal to you as much as they used to. And you might feel a lot more tired during the day than you used to. In addition, like I was saying, things that you used to enjoy, like for example, painting or going for a walk with your friends, you might not want to do them as much or even get the same amount of joy that you got out of them as you used to. And that could be a symptom of depression. Feeling guilty, feeling worthless, like having a very low self-esteem. And it can also affect your physical state of being. So some people who are depressed, they might move more slowly than other people, and people might start to notice, oh, you seem more tired, you're moving more slowly than you used to. And lastly, people who have depression can sometimes think about death or suicide.
Yeah. And so as Divya or Dr. Bana mentioned earlier, depression is not just being sad. Does anybody have any ideas why that might be? So kind of like Dr. Bana was saying, depression lasts a certain period of time. It has all these symptoms that she was talking about, but sadness is something that's normal to experience. We should all feel sad every once in a while, but it's when that feeling, that low mood just doesn't go away that we start to worry about depression. When you see a sad movie, of course, you're going to feel a certain kind of way, and that's a normal way to react. And so just to emphasize, depression might be associated with sad feelings, but feeling sad doesn't mean you're depressed necessarily. And as Dr. Bana was saying again, depression lasts 2 weeks at a minimum. That's how we diagnose depression. So if you have 2 weeks where you feel really low mood all of the time and it doesn't really go away, that's when we start to worry about depression. If you're sad for a couple days, if you're sad for an hour after listening to sad music, that's okay. Sadness is a normal part of our emotional experience. And the way that we treat depression is it's much more serious. It's a clinical condition that makes you eligible for treatment. and therapy and sometimes medication as well.
So does depression only affect adults? I think most of you know, no, it's not true. It can affect anybody, right? It can affect children, it can affect teenagers. And as we age, depression looks differently in different people. In children or adolescents, sometimes depression can make them more irritable. It might make them more prone to fights. And sometimes this can be attributed to normal teenage changes, but when it's persistent and when it lasts, for a period of time, and you've noticed some other changes as well, you might be concerned about depression. And like I was saying earlier, a lot of the symptoms of depression that we were talking about, like having low energy or not wanting to get out of bed as much, some of those might be associated with physical changes too, like medical illnesses, or even as we age, we might not have as much energy as we used to have when we were younger. So sometimes there can be a lot of things going on, and it's hard to distinguish when is it depression and when is it normal aging or part of getting older.
When you say children, like
Mhm.
what age would you say?
So typically, we start to imagine that kids might first experience depression around 12 or 13. But we even see kids who are like 9, 10, they are experiencing symptoms of depression too. So kind of that age range is when we start to see these mood symptoms, these mood disorders like depression or anxiety.
Thank you.
Oh, yeah, of course. And so is depression common? I can tell from the nods around the room earlier that people are familiar with depression, right? So it is very, very common. It is the most common psychiatric disorder worldwide. In the US, 20% of people, so 1 in 5 people, will experience depression at some point in their life. So it could be really early in life, like we were just talking about, all the way through every age group. And that amounts actually to about 21 million adults. So over 8% of our population had at least one depressive episode. So it's very, very common. Again, all the nods tell me you know that already, right? But this is an important issue to talk about because we want to be able to recognize depression if we're thinking that maybe 1 in 5 people might experience depression at some point in time.
And we can't talk about depression without talking about the impact of the pandemic, right? Ever since COVID-19, the rates of depression have increased by about 25%. So that's a huge increase over the last few years. And I'm sure you can all kind of imagine why, right? So as the pandemic started, it increased social isolation. It kept people from seeing their families, and the medical impacts of it, right? It took a lot of lives. People died from COVID, and a lot of families experienced that loss. And sometimes that loss persisted and resulted in depressive symptoms or depressive disorders. It impacted community engagement. It took people out of the hobbies that they were used to going to, like going to senior centers or going to the library or engaging in hobbies like dance. Even going outside to the park became something that people would think is dangerous or, maybe getting exposed to COVID. So now more and more people around the world are starting to think about the importance of mental illness and how prevalent it is, especially since the pandemic.
So this is a big question. If depression is so common, why is it so hard to talk about, right? In our society, there's a lot of stigma. So I know in my culture that we don't talk very much about mental illness. I don't know if that's the same in yours.
Yes.
The world is changing. We're getting better about talking about these things. But sometimes when somebody is going through depression, they view it as reflective of weakness. They're like, why can't I figure this out by myself? I just need to get out of bed. This is my fault. When in reality, it's not their fault and it's not a sign of weakness. It's that they have a real medical condition, like a true mental illness. But because we're kind of taught, oh, just get up, be tough, that can kind of make depression hard to talk about. It can be very hard to ask for help also. And some people don't want to be known as people with a mental illness because that feels very, very loaded as well. Even though, like we're saying, depression is very common, it's nothing to be ashamed about, but we've been taught in our society, by our families, by our cultures, to feel ashamed. And so that's why it can be difficult to discuss.
Yeah, I think Aubrey covered this slide already. It's not a sign of weakness. It can be viewed as a sign of weakness sometimes because of the way that society has stigmatized talking about mental health. And also it's deeply embedded in some cultural traditions, right? Like Aubrey was saying earlier, my culture also, we don't really talk about mental health. And I think as time goes on, those views are changing and people are starting to talk about it more and more. But I think it's important to talk about. No one wakes up in the morning and says, I think I want to be depressed today, right? That's not a decision that someone makes. It's a biological and psychological thing that happens to them. And there are reasons for it, like we were talking about earlier, and it has nothing to do with being a weak person or, anything else.
Okay. So now we got you, everybody down. We talked about how common depression is, how hard it is to talk about. We also need to talk about how it can be treated, right? So the first step is to get evaluated by a medical doctor. So a psychiatrist will come and do a full evaluation. They're going to ask you not just about your current symptoms, about your sleep and your appetite, but also about, if you have enough support, how, like, if you've experienced recent loss, if you still think about bad things that have happened to you in the past, they're going to try to get a really good sense of who you are as a person and the reasons why you might be experiencing depression. And some of your primary care doctors can also be point people for this. It doesn't necessarily have to be a psychiatrist, but you could say, hey, doctor, I think I'm having some symptoms. Can we talk a little more about it? And maybe you'll make a referral to a psychiatrist if you think that's necessary, but you can always go to any medical doctor and bring up depression. Also, a lot of medical offices now, I don't know if you've noticed, but they always do screenings, right? They give you like pieces of paper or they ask you a lot of questions about how your mood has been. That's them also trying to make sure they're not missing depression as well. And then once you have been diagnosed with depression, you can get a couple different treatments. The first is medication. So there are a couple of different types of medications that people can get that help with depression. You can also get counseling, so talking to a therapist, having someone you see once every week or two to kind of talk about different ways that you can cope, different things that you could do to make yourself feel better. That's what counseling is for. And then really severe cases of depression, if you're not responding to medication, if you're not responding to therapy, there are different ways that your brain can be stimulated, either with magnetic stimulation or electric, like electroconvulsive stimulation. So that's the kind of, if everything else has been tried and it doesn't work, that's when you would move to, it's called either TMS, which is magnetic stimulation, or ECT, which is electroconvulsive therapy. Okay.
So we've talked about all these different treatments, right? So how do you decide what treatment you're going to start with? So this is a conversation you can have with your doctor, whether it's a psychiatrist or a nurse or a therapist. You can talk to them about the options and go through what makes sense for you, right? Because the answer for one person isn't going to be the same for everyone. Medications might work faster than counseling, but they come with side effects, and sometimes they can interact with medications that you're already taking. So it's important to discuss whether that might be the right move for you. There's also a lot of stigma around medications, right? People thinking, I don't want to take a medication for depression. So that's something to talk through and see if that's going to be the right fit for you. And also, taking a medication doesn't mean you have to be on that medication forever, right? It can be a short-term thing, and you can talk about weaning off of it. Or if it's really helping and you feel like, I really feel a lot better, I don't want to stop taking this, I think that's okay too. Also, talking about therapy and counseling, there's a one-on-one relationship with a trained professional. And so the importance of it is therapists are trained to identify moments in your life that are impacting your depression and your mental health and they can identify patterns that you might not be able to identify on your own, right? So it might just feel like you're telling someone about your day to day, and they might say, hey, I think something similar came up a few weeks ago, and I think these two things might be related. And it's helpful to have someone else who's trained to see those patterns, help you identify how this depression could be impacting your life, and help you make those changes without having to take medications or in combination with them.
The next question is, when will I start to feel better after starting treatment? We all want a medication that makes us feel better like this, right? Like right away. Unfortunately, with depression, whether you're getting medication or you're getting therapy, it takes some time. So for medication, some people will start to feel a little bit better within 2 weeks, but to really see the full effect of both medication and therapy, they say it takes about 8 to 10 weeks. So it does take a little patience. It takes a little while. It's not going to be an instant, like you flip a switch and you feel better. For some people, even knowing that they have depression, even being diagnosed, that can instantly make them feel comforted. But once you engage in treatment, it takes a little while longer to get those benefits. And yeah, different combinations of treatment work. Maybe you want a little bit of medication and a lot of therapy, or a lot of therapy and no medication. You can always talk to providers about what makes the most sense for you.
And are there other ways to support your recovery? Yes, always, right? So we always emphasize the importance of lifestyle changes, right? Exercise, a good diet, meditation, faith and prayer can also be a strong source of support for people who are going through depression. And even acupuncture, Tai Chi, there's so many different types of alternative medicine and natural medicine that can be helpful in supporting recovery. But these are always best in combination, right? So if you combine exercise, healthy eating, and meditation with a visit to the doctor and some therapy, or with medication, it's going to work better than one on its own. But all of these things above are going to be helpful, and they're worth trying, especially because exercise can't hurt, right? Meditation can't hurt you. There's no side effects to it other than you might feel a little better. And if you don't, that's okay.
Like we could hear people singing through the wall. That's a way to kind of start getting the wheels turning and addressing depression too, doing things that you enjoy, being with community, being with other people.